a lot of really good feedback from the last discussion we had, which was all about how to do a wellness plan, what sort of things to involve, how to bring that up from start to finish. And there were a couple of questions that came out of that. And I think the one that most people had is, okay, I really struggle with keeping my clients compliant and keeping them committed to a program that they sign up for. So I really wanted to make that the focus of our topic today. And that's pretty much what we're going to spend some time talking about. And again, jump in when you've got comments to make or experiences to share. Please feel free to jump in on that. So last week we were talking about how to set goals and using the acronym SMART for that. Remember that: specific, measurable, attainable, realistic, and timely. And that comes into, I think you have to think about that with everything that you're trying to do with your client. So if we think about client commitment, many of us talk to people, and it may be a patient. Janet, looking at you, I know you have patients that come through. So whether it's patient or client, we all have people that come in and you talk to them and they're really excited and they want to get going and they commit to either a next session with you or a series of sessions with you. Some of them even pay up front for it, and then a number of things happen. So the first thing that happens, and many of us have experienced this, is even though they've paid for a program, you never hear from them again. I mean, they've paid you and you're waiting and nothing ever comes back. Many will do a first session with you, and then for some reason they kind of drop away and you don't see them again. Then you get those clients or patients that will do the first phase with you that you've set up in your wellness plan, and they see it through, and then they seem to disappear at that point. And then you have some more that kind of are with you long term but somehow drop off your radar and you're no longer working with them. And then for some of us, we have some of those really excellent clients or patients that are committed with us long term, get it, and are working with you, and you're working as a team to improve their health. So what I want to talk about is those different clients and the point at which you lose them and why that might be happening and how to try and change that. So that's where we're going to take the discussion today. So any questions, any experiences with that? Janet, I mean, in your practice, what do you see with people? Do you see them committed and staying with you long term? Do you see them dropping off?
I have actually pretty wide variety of what people do. Mm-hmm. Pretty much everything that you just mentioned, I've seen.
Yeah.
The ones that a lot of times feel the worst are the ones who do stay the most committed.
Yes.
The ones with financial issues are the ones who have a greater tendency to drop out. Mm-hmm. And I do understand where that comes from.
Right. Yeah. And I think we all struggle with that. So we'll touch on that today as well, is how do you help those that financially are really struggling? And very often it is the ones that are in the need of the most help because they've been to the most doctors, they've been to the most practitioners, they've spent their money, they're no longer working because they're so ill, and they haven't got the disposable income to do a lot of the work that you might want them to do. So that is an issue, and it's one where it comes to the practitioner understanding the pace at which you have to work at. One of your biggest roles there is setting that pace and working within the means of the person there and making sure that everything is very focused, that you're not wasting the money they have, that any testing you do is focused to what they need and getting the most information you can get, and that you're not over supplementing and not giving them different ideas of things they have to do, whereas one product might do all of that for you and save them a lot of money. So there are different things that you can do there to help them on the financial side. So I'm going to be pulling on you a little bit today, Janet, because Bob doesn't have his visibility up. So I'm going to be using you to kind of go back and forth on a little of this. So sorry about that, but hopefully next week we have more people that are sign in live and can be part of the discussion.
Because I'd like to meet some other people.
I know. Well, I was so excited today to see 35 sign-ups. And I thought, there's some really great practitioners here. This is going to be a wonderful discussion. But if they're not part of the discussion live, it's hard to have a discussion a situation, and this is not supposed to be a training session, it's supposed to be a discussion. So anyway, hopefully people will jump on, and maybe I'll need to do a poll or something to see if there's a better time for getting people to be able to get into these calls. All right, so let's talk about those different situations of when we lose clients. So what those patients and clients that pay and then you really don't get anything from them. They don't send forms back. They don't send their test kits in. Nothing happens, and yet they paid you. Very often, these are the people that feel that they should be doing something, but they're not ready to do it. They're in a point on their health journey where it's just not time for them to be doing this work. And you can typically weed those people out if you do a really good initial call. These are the people that won't be listening to you very well, or kind of have a lot of excuses, but know that something's wrong, feel they should be doing something about it, and they think that by signing up with you and paying you some money, they're doing something about it, but they never get around to it. So these are the people that you should absolutely say, sorry, you're not in the right place at the moment for me to work with you. And they don't like that. They don't like to get rejected because they think everybody's going to want to work with them, take their money and help them. But if they're not in the right place, then they're just going to let you down in that they're not going to turn up, they're not going to send forms back, they're not going to do the testing. It's a waste of your time, it's a waste of their money. They won't talk well of you out in the field, so you won't get referrals from it. So it's far better to say to someone like this, sorry, when you're at this point, when you're truly committed and ready, I'm here. But right now it's going to be a waste of your money for you to work with me. So don't hesitate to turn people away. That's very hard for new practitioners because you're trying to build your practice. So those people are few and far between, and it's hard to be like that. But it makes people sit back and think, well, hang on a minute, why don't they want to work with me? And reverse psychology is you normally get a call back fairly soon saying, look, I understand what you're saying, and I've thought about it, and I'm committed, and I really want to start this work. So sometimes being hard up front gives you a more committed client going forward. So hard as it is, sometimes just say to someone, you're not ready yet for what this work will entail. Then there are those people that kind of do start with you, but we say drop away pretty quickly, and you'll hear things like, oh, I'm way too busy, or this is too expensive for me, or I don't have enough time, or this is too difficult, or I'm too tired, I don't have the energy. Some of those excuses are legitimate. Financially, maybe that's true. Energy-wise, if someone's really depleted of energy or has an issue with depression, it's hard for them to get connected, to get involved, and to move forward. That's where you as a practitioner have to jump in and really help them move beyond that. You've got to find a way of opening that up a little bit so that you can get that first step there. I know that we're in sort of more of the natural field, but sometimes if people are really depressed, maybe the first step for them is seeing a doctor and getting on medication short term to come out of this so that you can help them. So it's not always about doing what we do. Sometimes the first step may be a referral back into a medical professional. I'm not saying that's always the case, but sometimes with some people, if they're very stuck, that might be the only way to get them unstuck. For the people that are saying to you, too busy, I don't have enough time, I just, this is too difficult, you've got to really ask them some difficult questions. I think that's when you've got to sort of sit them down and say to them, why are you not worth this? Why do you not feel that working on yourself and going to the next level is worthy? What is it that's stopping you? Very often there's an emotional component there. There's a block. And once you ask a question like that in a very non-threatening way, but just try and open up the discussion, very often you'll get the tears and the breakdown, and the kind of, it will all come out as to what the problem is, and then you can move on from there. But people are very good at making excuses as to why they can't do something. Try and turn that around as to being, well, why wouldn't you want to do this? These are great things for you to be doing for you. Make it, instead of being negative, make it positive. And just make sure that you're empowering them in that way rather than working against them. So I see we've had a couple more people join us. Feel free, this is a discussion, so feel free to jump in at any point with any questions. I would like to get an exchange of ideas here. So welcome onto the call and into the discussion, and let me know if you've got something that you want to add at any point. So at this point, anybody would like to add to the discussion, feel free to speak. Okay. All right. So going on from here then, let's talk about the people that are, they start the program and they get the testing and they get the protocol from you, or they get a diet from you and you just never hear from them again. They drop off and they don't call you, or they're not available for their appointments, or they keep rescheduling. In this situation, very often it's the practitioner's problem, not the client's problem. And the reason for that is that you've either overwhelmed them, or you've made it too difficult for them, or it's too expensive for them, and they didn't want to tell you because they thought they were going to hurt your feelings. But the expectations were off. You just weren't on the same page. And people get overwhelmed very quickly. I think as practitioners, we know how much we've got to do with people, and we definitely want to help them and we want to give them everything we've got, but in doing that we can sometimes really overwhelm, and when you overwhelm someone it's easier just not to bother. Diet's one of the main things that you'll see that happen with when you ask people to make changes with their diet. It can be so overwhelming that they just disappear, and that's because you didn't understand that you needed to take it slower with them, go down to baby steps with them. It might take you a year to get a diet in place for somebody, but as long as you're making forward progress and they're staying connected with you, then you're going in the right direction. If you do too much too quickly and you lose them, you've lost a patient or a client, and they've lost out on all the help that you can give them. So when you're in that situation where you've given someone that protocol or the diet and you think they're going to follow through and they disappear, look to the way that you were interacting with them as being the issue there. When we lose people after the first phase, so let's say you signed up with them for 3 months and they kind of get through the 3 months, and then they disappear on you. You don't see them again. Typically, this is a mismatch of expectations. They expected to be further along or somewhere different after 3 months, and they're not, and so they're kind of losing confidence, losing faith that all this work they're doing, and they're not seeing the results that they expected to see. So it just means that those expectations weren't set correctly by the practitioner at the beginning. So it's not a bad idea to get commitments as you go through, as we were talking about with the last discussion. Getting someone's commitment's really important, and saying to them, right, this is what we've agreed that we're going to do over the next so many weeks. Do you see yourself being able to do that? And these are the expectations. At the end of this period of time, you can expect X, Y, and Z. And it may be 3 different things. You're either going to feel absolutely great, or we're still going to have more work that we have to do, or you may just be beginning to see yourself improving and we'll have more work to do. But you have to set realistic expectations to keep people connected with you. Otherwise, they feel they're not making progress and they disappear on you. So talking about expectations and being on the same page and understanding what you're both working towards, I wanted to bring in a little bit of information here on listening techniques, both for you understanding how you listen to people, but also understanding how someone that you're working with may be listening to you. And this is probably information that you've all heard about before and gone through, because we've all done incredible courses out there and we're very well informed. And sometimes it just helps to be reminded of different levels and different things, so that we think about that, we're consciously thinking about what we're doing with people and what people are doing with us. So I just wanted to go over the different levels of listening and maybe bring that into the discussion. And there certainly is more to listening than just hearing what somebody has to say in words. So it also includes listening to different sounds, body language, intonations that people use, how they talk, where their eyes are when they're talking. Many of you probably recognize that my eyes are very rarely straight on the camera because I don't like cameras very much. So my eyes are darting around. and that gives you information about me just by watching the way that I present this. So you'll also see me making a conscious effort to look directly at the camera, which I've just done. And that takes a lot of work for me because I'm quite a shy person. But anyway, there's a lot that you can tell about a person other than just listening to the words. But let's go through the different levels of listening. So generally, there's recognized to be 8 different levels of listening. The first is passive listening, or often called not listening. And that's where you're really not hearing what anybody is saying. You're not registering it. You're not listening. For example, I don't know if you've been out with someone and you've had a meal with someone and their phone goes and they say, oh, sorry, I've just got to take this call, which is incredibly rude to start with, but they take the call, put their phone down, and then they get a text message and you're in the middle of discussing something and they're going, yeah, right. Or they're not even giving you those signals. You realize that you're talking to someone who's really not listening at all. And if you have a client like that, then you know straight away that they're not hearing what you're saying. So think about that. Think about when you get into those situations. Pretend listening is very close to that. And I think a really good example of pretend listening is parents with children. When you're multitasking, you're trying to do something and your child's telling you about something and you're going, yeah, right, yeah, that sounds great, yeah, brilliant. Did you really hear what they were saying? Most of the time we haven't heard what they were saying. And so that's pretend listening. You're giving signals that you're hearing, but you're not actually hearing. So we as coaches can fall into that trap. We can be listening to someone, particularly if we're involved in a long distance call where we're on the phone and someone is talking to us about something and going into an awful lot of detail. It's very easy on a phone call, particular where you haven't got the visual clues in the same way. It's very easy to kind of lose your focus, and you're giving the clues that you're hearing and you're there, but you don't actually take the information in. So as coaches for yourselves, be really aware of that if you do a lot of your calls long distance. And then when you're working with people, again, watch how they're taking on information, and you may find you either have someone not listening or someone who's pretend listening to you, and you need to stop the conversation, bring their focus back, and try and understand why they're not connecting, what the problem is. Next level of listening is biased listening. And here you're taking in the information, but you've got an opposing or different view. And so that you're not allowing anything that is said to influence your understanding or your information level. So this one I find is quite important to coaches, because I don't know if you've ever worked with someone who is a professional athlete or someone who has made the decision to be a vegetarian. Both of those groups of people, I find that I'm very often dealing with someone who's listening to me in a very biased way. They're not open-minded. They've made a decision, and it doesn't matter what you say, that they don't hear what you say because of the way that they view something. They can be very difficult people to work with in certain areas because of that kind of biasness they have with the information they've already got. So I think that one is mostly the clients or practitioners that you look for that in, rather than it being something that you do. Although you may feel very strongly about something and not hear what your client or your patient is saying back to you. So be very aware of that as well. And that as coaches, we have to be very open-minded, and we may not agree with something, but we also need to hear why that's important and discuss that fully to see how we can work with that in an overall protocol or program. Any questions so far? No discussions? All right, Janet, I'm calling on you. Anything?
The one, I guess the problem that I have run into with some clients is that they have been to so many people before, it hasn't worked, and they are fearful that this isn't going to work either.
Yep.
And they're very reticent when it comes to even sharing all of what they have done before, because, well, that just didn't work. It just didn't work. I hear that with that tone of voice, even that just didn't work. And so I find those are the hardest people.
So in a situation like that, Janet, where someone says, oh, I've been to all of these different people and it just didn't work, how do you handle that?
Well, the basic thing is that, we're going to approach this a little differently. We're going to test. We're not going to guess. I'm not just going to tell you that you need this supplement, those drops, this, that. We're going to look at things. We're going to find out what's in there. And that's when I sort of start to, okay, well, maybe. And then they get a little more, but these are people who, they come to me for chiropractic, but they have these things that are going on that their chiropractic care isn't taking care of the problem. So that's where, okay, we have to look at inflammation, and we have to look at their exercise and their stress and their, okay, I'm taking this med and that med, and my doctor says I can't ever go off of these, and they're scared to death to try something on their own. Even you start to get a lot of mixed emotions from those people because they want to feel better, but they're scared to try anything else.
Right. And they have been through a lot. They have usually spent a lot of money as well. So, I mean, you've got a number of different defensive barriers that have gone up. I think that you know, with those people in particular, you have to sit back and you have to ask them, can you tell me a little bit about why it didn't work? What do you think went wrong? What wasn't right? Why do you think you feel the way that you do? Because sometimes if people have gone through lots of different practitioners, sometimes the problem is the client, in that they don't see something through, that they are not compliant, and that it's almost like their illness has become their life, and going into different practitioners has become what makes them feel that they're very networked and together, and going out there and doing different things and working on their health, without realizing that they work with some really great practitioners and sometimes some really awful ones, but they have worked with a lot of great practitioners who have done a lot of the things that you might think about doing, but they haven't got they just don't see it through, so they don't get results. So you have to, I think when you start hearing that, you've also got to push back a little bit to understand exactly why they think that's the case and where they've come from.
The hardest ones to deal with as far as getting across the barrier, I find, are the ones who have been told by someone that you're always going to have this problem, to the point they go, my fibromyalgia, my arthritis, my depression. They own that condition.
Right.
And
it defines them.
Seriously, they don't want to let go of it.
Yeah. Exactly, it defines them. And Bob has just put a chat down here. He said, you know, they have to hear this same spiel so many times already, and I tell them to give me 3 months and let's see what happens from there, right? So that's true. You want that commitment. You want them to give you enough time that they can learn how you work, to trust you, that you have got their best interest at heart, that you have the plan for them, and this is the plan, and this is what you want them to commit to. But at the same time, if you hear them saying things like you just said, Janet, where their illness is defining them, that it's not that they think they want to be ill, but it's who they've become. And without that illness, who are they? And so at that point, you know that you've got a lot more emotional work to do to find out why that's so important in their life. Are they so isolated, so lonely? You know, some people don't have any friends, any relatives. They're very isolated. Their illness allows them to go out and meet these different practitioners and talk. and they use that as their way of interacting. As sad as that is, in some cases, that's what you're seeing. So you have to ask some questions there to understand in those situations, you know, what they've been through, where they're coming from, and whether really they're the problem in that, or truly other people have let them down, or is it a mixture of both of those?
Mm-hmm.
Okay. All right. Well, those great comments. Thanks, Bob, and thanks, Janet, for jumping in there. That was that you know, that I think we all meet those people, and it's something that we have to understand how to handle when we do. So going back then to some more of these different types of listeners, we've got misunderstood listening. And this is really where people are not thinking objectively, so they put their own interpretation on something. And this is where expectations, we were talking about people losing clients because expectations weren't the same. This is where your expectations can really differ, because you can be talking to someone and they will interpret the way they want to, not the way that you were talking about it. And so you end up with that misunderstood listening, and that's where you'll find people disappear on you, because you're working on different tracks really, and you never sort of come together. So always a good idea when you're talking with people, and hopefully they are hearing what you're saying, to sort of get them to repeat back, you know, well, can you summarize what we've been through today? Can you summarize what our next steps are? Put them on the spot. Unless you're working with someone who's got severe brain fog or memory issues or something like that, because then they will feel very defensive. But for those people, when you know you're working with someone like that, you can actually write this out as bullet points, and it could be 1-2 bullet points. You certainly don't want many more than that, because again, you don't want to overwhelm. And you can get them to say, yes, I you know, we're on the same page. That's my understanding. So there are different ways of dealing with this, but for most people without brain fog or without memory issues, where they are functioning relatively well that way, ask them to summarize, put them on the spot and say, right, can you summarize what your next steps are? Can you summarize what you're doing between this meeting and next week? Can you summarize what our long-term plan, whatever it is you've been working on, get them to summarize that. And remember, you've got that wellness plan that if you've written out, you can highlight where it is in your plan and say that we've moved on to this phase, and get their sort of approval, and they're okay, that they feel they can do it, they're not overwhelmed by it, and you're both on the same page. All right, so then we get those listeners who are attentive, data only listening. In other words, they're hearing the words, but they're not taking in any of the other signals around them. And again, this is one, it's not so much for you as practitioners, but it's more for when you're working with someone and they're sort of missing out on a lot of the clues that are there. Now, as practitioners, it does involve you as well, in that you can tell from people, from their expression, from their tone, whether you're getting through to them or not. So use those skills, but be aware that sometimes your clients are not focused enough in on the conversation to be reading you that way, and so they may miss something, or can work the other way. If you've got highly tuned in clients and you're getting frustrated with someone and you're trying not to show that, I mean, those people will pick up on that from those clues. So be aware that sometimes our facial expressions can give us away, and you've got to be as neutral as you can be when working with people.
What was that last one called? The last type of listening?
It's called attentive or data only listening. And those are the people that just listen to content, and they're not receiving all the non-verbal clues that go with that. So next is active listening. And active listening is where you're really tuned into everything, clue-wise, like expressions, intonations, expressions, and things like that. So you're picking up on that, but you're not picking up on any of the emotional side that's there. So as coaches, you want to be active listeners. You're picking up on as much around you as you can, but there are two additional levels here that as you develop as a coach, that you need to get into. And then, so that next level is including the emotional side. So you're listening with full attention. you're not just taking in the words, but you're looking at body language, facial expressions, feeling, tone of voice, delivery of what somebody is saying. So how they're pacing what they're saying, the volume of their voice, their breathlessness, how it flows, all of that gives you a lot of clues. And body language. So this is called the empathic listening. And again, as you develop as a coach, you develop these skills where you're kind of getting all of the information in along these lines. Body language. There are some things here, I wrote a few of these down just to sort of give you some clues as to what you might be looking for. But if someone is usually looking at you with their eyes and making good eye contact, and then you're talking about something and their eyes shift to the right. So if that happens, then it's more of a creative mode. And if someone goes into more of a creative mode, they can be fabricating or guessing or not quite telling the truth. So if you see eye shifts, it may mean absolutely nothing at all, or it could mean that you've got somebody there who's kind of not giving you the right history. For example, if you're talking about their health history, or they're trying to tell you they're doing something that you've been asking them to do, and they're not quite doing it that way. So if you see that eye shift and it happens a couple of times and you feel there's something there, then follow up on that with some questions. Just say, well, can you take me through what are you doing here? And sort of probe a bit more to see if you can catch what the problem is. Someone who gives you a tight-lipped smile tends to mean that they're holding back on you. So if you're getting into some emotional work and you suddenly get that tight-lipped smile, you may have pushed a little bit too far. They may be uncomfortable going where you're going. You may either need to sort of step back a bit from wherever you're going with the conversation, or probe a bit to find out why they're uncomfortable. What is it that you're getting close to that they maybe don't want to get into? If people like to please you. So if you've asked someone to do some work on diet and they've said they will and they didn't quite do it, but they don't want to tell you that, this is when you're going to see some of these sort of body language signs coming out. To catch somebody biting their lip, particularly their bottom lip, you've just witnessing tension, stress, anxiety. So if you're talking about something, again, let's use diet. Let's say you're asking them to do something with their diet and they start biting that lower lip. They might tell you they're okay with this, but they're worried about it. Something about what you're asking them to do is creating a problem. So probe a bit. Okay, I sense that you're a little bit anxious about this or a little bit stressed about this. Is there something that we need to talk about? Are you happy with this? Is this something you can see yourself doing? And very often, if you pick up on that clue and ask them about it, they'll open up more. If someone is sitting there in your office, or if you're seeing them on Skype and you suddenly get the hand like this, then at that point, they're holding something back. There's something that either they didn't like about what you just said, or there's something that you've hit on and they don't want to go there, and that hand goes up and you see this happen. At that point, that's another good clue that there's something there that you might want to follow up on. Sometimes people cross their arms. I'm an arm crosser, but I'm also a very private person. And if you see someone cross their arms or cross their legs, that can be kind of a defensive mode. It's kind of protective of my space. Again, that's a good clue to pick up on, particularly if you see it happen in a certain conversation that you're having. Why did they suddenly get protective of their space? What is it that they're getting defensive about? Sometimes it's just the way people are. I sit down and I cross my legs, and that's just my way of sitting. So it doesn't always have to mean something, but it's always a good thing for a coach to be so tuned in that you're picking up on that and wondering if there's something more there, and then following up on that. If someone suddenly scratches their nose or kind of goes to the back of their head like this, again, you've got to think about them being uncomfortable. Exaggeration maybe, doubt, disbelief, something's made them uncomfortable, or they could just have a really sudden pain in their back. So it doesn't have to mean that there's something more going on there, but it's always worth kind of following up. And sometimes if I see somebody doing that, I'll say, is your neck hurting? Because that's another clue that maybe there's postural issues, or work that they might need to do with a chiropractor, or something else that's going on that wasn't on an intake form and hasn't come up before. So the whole time you're working with someone, you're looking for these different clues. It's not just about the words. It's not just about the intake forms. It's about the way that they are when they're talking with you. So if you have people in the office, it's really easy. If you're working with people long distance, you definitely want to try and open up Skype or some sort of visual with them, so that you at least are getting that input and they can see you. It's far better than just having a call over a phone where it's just the voice, because it's far harder for you to pick up on the clues that you need as a coach. So any questions on body language? Anything that anyone else can add to that? It's just a very short list of different examples, but anything that anyone else has picked up on that they kind of tune into very quickly? No, I can hear someone typing, so maybe there's a question coming in. No? Okay. All right. So if we go back to the last level of listening, this is called the facilitated listening, and it goes beyond the emotional component that we just talked about. This is kind of the very top level of listening. Not many people get to this level. Coaches, though, because of the career they've chosen, the profession they've chosen, and the way they interact with people, are the ones that often get to this level. And so this is what you want to aspire to. This is what you want to try and work to. And this is where you're able to interpret the self-awareness of the speaker. And you're able to weigh up the consequences of the other person's behavior, even if they're not able to do it for themselves. So it's almost like you're intuitively able to go in there and pick up on what someone's feeling because of what you're hearing from them, from the words that they're saying. They may not even be aware of this. I mean, this is something that you become more tuned into as a coach with the more people that you work with. And this is if you have this intuitively and you know you have it with people, you would make a great coach if you're not a coach, because those are the skills that you need to really be able to move someone forward, to be able to kind of understand where they're struggling before they know they're struggling, and to be able to open up those doors to them, to be able to kind of get more information from them. You've got to exercise caution with this one, and it's caution on their behalf, because you don't want to over push them or over influence them or frighten them by things that you're picking up on. And there's a time and a place for every conversation, and as coaches it has to be at the right time. So just keep that one in mind. And yeah, we aspire to be at that level. Sometimes we find that very easy to be that type of listener with many of the people that we work with. Most of the people we work with are not those types of listeners, because they're very divorced from their bodies. They don't know how to listen to their bodies, so they certainly don't know how to tune into other people. So it's very rare that you're going to meet somebody who turns this back on you and says, oh, hang on a minute, Jill, where are you with this? I've had that happen a couple of times. It's quite unnerving. You don't expect it. But most people are so out of tune with their body and out of tune with other people that you're not going to see this coming up with them. So any questions on those last couple of types?
Can you repeat the eighth, what that was called? There was kind of a breakup in the...
Yeah, it's the facilitated listening.
Okay, thank you.
Mm-hmm. Yeah, and you can, there's courses on listening. I mean, many of us have done this, as I've said, as basic courses in coaching and psychology and so on, but you can always research these different levels and get more information about it. But I just felt it was important to kind of remind you of these different levels and make you aware of it as a coach yourself when you're interacting with your clients, but also be aware of that when you're in front of someone and understand if they're tuned into what you're saying or not. And if they're not, then maybe it's time to stop the conversation. Maybe you've been talking for too long, or maybe they're just not getting what you're talking about. You've got to find a different way. Most people's attention span is very short, and typically we'll do 1 hour sessions, and Sometimes people can only really tune in and listen properly for about 20 minutes. So going with shorter sessions and really understanding the type of listener you're working with can help you get better commitment from the people that you're working with, but also make sure that the expectations are on the same page, and so get better results. All right, so I've got another message that's come in here. Is there a best way to confront a client that you feel is lying or not giving you the right information, especially if it's something that will affect the outcome of their wellness plan? Very good question. So my philosophy on this, and again, it's going to be different with each person that you work with, but if you know someone's not telling you the truth, you've got to call them on it. You have to call them on it in a very non-judgmental way. You're not giving them a hard time about it, but you're just letting them recognize that I'm your coach, I'm working with you here, I'm helping you, we're trying to get from A to B, and I know that you're not being upfront with me, and I need to understand why. And so it's not a problem that you're not upfront with me, but I need to understand why, because it doesn't make sense that you wouldn't be honest with me when we're working together in your best interest. So my recommendation, unless you're working with someone who is very on the edge, is to confront them with them. And sometimes even someone very on the edge, if you're qualified to do it, take them over that edge and have that breakthrough, have that emotional release, because then they'll start the healing. I think we don't pay enough attention to the emotional side of many of our clients' issues. And so sometimes you've got to push a little, but only if you're comfortable with that, and only if you feel that you can handle the release that may follow that. And certainly if you get into a situation where a client in your office or on a call has an emotional release, you can't cut the session short. You can't say, sorry, your hour's up, I've got to go now. You have to talk them through it. And that means that you will not be there for your next call or your next client, and that has to be all right. People have to understand that if you get into that situation, you can't leave someone hanging in that state. And if you feel that someone's had an emotional release and you realize that this is really deep and it's outside of your scope of practice, refer them, right? There's nothing wrong in referring people to get the help they need if it's something that you can't handle yourself. And I think as practitioners, we all need to know where that line is. We all need to recognize there might be things that we come across that we are not qualified to handle, and we need that referral network there. So there's nothing wrong with referring into somebody else, and spending time as a practitioner working that referral network is really important. So you have those links for people that may not have those contacts themselves. So any other questions? No, I don't see any other comments being here. So, all right, so going back to, we'll just finish off. We've got about 15 more minutes here. And we started talking about when we lose different people, and we were talking about different expectations, which is why we went into talking and discussing the different listening levels. You can also have people who disappear after a period of time. And that can be, they've gone through the first phase and they're actually doing really well and they don't need the input anymore. And if they start to slip again, they'll come back. But it can also be because a practitioner has got too busy with new clients coming in and doesn't spend the time supporting their older or longer standing clients that they've got. Or it could be because the practitioner themselves reaches a point where they don't know where to go next. So if you get to that situation where you've been working with someone and they suddenly drop off, do question, well, is it because they're well, which is great? Is it because I'm too busy and I haven't put the time into them? Because even your long-standing clients need your time. They need you to be guiding them through their wellness plan. Or is it because I'm now stuck as a practitioner and I don't know where to go next? And that might mean that you've done all of the basic stuff, you've used the tools in your toolbox, you've kind of run out of what to do next, where to go next. Either you refer at that point, or you use a service like our service at Admentium, where you're working with very experienced practitioners that can help you look at a case and where you got with it and give you suggestions of where to take it next. So you don't have to get to that point where you feel overwhelmed. We're all learning all of the time, so you're adding new tools to your toolbox, but don't lose someone because you feel that you're lost. As I said, just refer them or get help yourself as a practitioner as to where to go next with that person. So going back to wellness planning, the whole idea of wellness planning, and these are different aspects of wellness planning. We talked about the acronym SMART and having those goals in there. And when you've got that plan and you've listened to everything, they've listened to you, you're on the same page, you definitely want to put in place a commitment. And I typically have when they first start working with me, it's a 2-page document, which is a commitment that I ask them to have handy that they refer to. I first of all get their agreement that they can do what we're asking them to do and they don't see any problems with doing it. And then we make that commitment together where they're kind of making a promise to themselves. And I'll read you here, the sort of wording that I'll put into that commitment is something like, from this day on, I promise to do my best and take daily steps towards my wellness. I'm doing this so that I can be at my best for my partner, my children, and myself. So what you're doing here is they're making a promise to themselves, as, I'm going to do my best to work on this. There may be some days where I'm not so great, but I'm focused on this. This is my commitment. And they're putting down why they're doing this. What is their goal? What is their purpose for this? Because this is their program. It's them that should be wanting to do this, not you pushing them to do it. So get them to actually sign off on something like that and then have it prominently displayed, have it up somewhere where they see it each day. It reconnects them each day to that promise, to their commitment to do this. And we all have days where it doesn't go so well. We all have days where we're on vacation and we decide it's not going to go so well. But generally, this is the commitment that you are making to get back to better health and to have that full realization of your potential rather than just trying to avoid disease. A couple of other ideas just to finish off on the wellness planning side is affirmations work really well for people. Give them something that they can say. It could be that commitment that they've just signed, or it could be a different affirmation. If you're into the emotional freedom technique where people are tapping to help with different things, affirmations are great as part of that emotional freedom technique. So think about the use of affirmations and using that with those people that you feel will go with that. Some people are very anti-affirmations, but some people need that to reinforce what they're trying to do. Another idea in your wellness plan is to make people feel part of a group. So try and pull your groups together. If you've got a group of people working on fatigue or weight loss, put them in a room together, bring the groups together and make them realize they're not isolated, they're not on their own, and we all face the same issues. If I'm working with people that are used to sitting and don't get up very much, and we're trying to get them more involved in activity and being active and doing enough each day, I actually send each of those people in that group a Fitbit, and we are on the same Facebook group with the Fitbit, and we try and make sure we all do about the same amount of activity. Including people in groups really helps them to stay focused. And then the last thing with your wellness plan, I think, is build in rewards, something that means something to that person that you're working with. So a square of chocolate, and the right sort of chocolate, but a square of chocolate at the end of a day or a week, or, if you get to this goal that you've set for yourself as part of your wellness plan, you can have a day in the spa. What is it that motivates that person? Allow them to build those types of rewards into their plan so that they can see that it's not all just hard work, particularly at the start. There's some good things that go along with that when they reach different goals. So I think, there's a lot of different ideas there for you as part of wellness planning and helping people get where they need to get to, and keeping them committed to that plan. And so, that's, I think, really important for you as practitioners to be aware of and be thinking about each time you start working with a new client or patient. So, any other comments to that? That's pretty much what I wanted to bring up into discussion today and talk about today. So any other comments from anybody? Janet, did you find that helpful? Did it kind of bring things to the forefront and make you think about them?
Oh, yes, definitely.
Good.
Yeah. Some of these things you just, you forget on a day-to-day basis. You go through your day and not everybody's complicated, and these things aren't, just reiterating there. Right,
exactly. All right, well, I don't see any other comments here, so just let's close by saying these discussions, at the moment, I'll probably do about once a month, depending on how many topics people are giving for discussion. I don't want to overwhelm everybody. We're all so busy with different things that come up and different courses and webinars and meetings and so on. I think it's really important to have discussion groups where anything can come up and be discussed. So I encourage you to share the fact that we're having these discussions with other people. I really encourage you to let me know if there's topics you want discussed, if there are things that you struggle with as coaches that you'd really like to open up to discussion. Either email me or, I've got a network platform going where we can discuss things as coaches and practitioners out there. So if you make me aware of what you want to discuss, then I can bring those topics in. Otherwise, it's going to be very much me recognizing, okay, these are questions I get. We'll use this as a discussion point. But I don't want to make these into training courses. I do want them to be discussions where we meet together as a group and exchange ideas and learn from each other. All right, so anything else before we close? No? All right. Then I wish everybody a great end of week and a good weekend, and I look forward to hearing from you either by email or, if anything comes up where you need some help, you know where to find me. I'm honestly here to just help coaches and practitioners on the front line do what they need to do and help support them in what they're trying to do. So, don't forget that I'm out here if you get stuck.